Even with a healthy body and youthful face, our hands can give away our age. Nicole Bell from Face Today Medi Clinic has just returned from Austria with some Australian firsts in hand rejuvenation. Welcome back.
Hi, Susie.
We've missed you.
Oh, thank you, thank you. I had a good time, though.
Tell us about Austria.
Well, there was an Austrian summit for Radius, which is a product, a new dermal filler, and they invited one injector from each country to convene in Austria to compare techniques, and I was invited from Australia. So it was phenomenal in just seeing what the latest is, and the buzzword around the world is pan-facial rejuvenation and hand techniques. So it's a way of doing rejuvenation for the whole face, and everyone's sort of steering away from surgery. And certainly it's all about the hands, because otherwise you've got this beautiful face and your hands are actually telling the truth.
It really is true, isn't it? Like our voices, our hands really can't be camouflaged, unless,
No.
of course, we're going to walk around wearing gloves for the rest of our life.
Absolutely.
So what's the latest in hand rejuvenation? What can we do to make them look more youthful?
Well, with using this particular calcium hydroxyl apatite, it's all about elevating the tissue in between your tendons and your veins. So as we age, we actually lose volume in our body everywhere, and when you lose it on the backs of your hands look really aged.
Now, the shot we're looking at now is you've got one hand that has been done and one that hasn't.
Yes.
Quite clearly, the one that hasn't been done is the one on the left.
Yes.
So what have you done to the one on the right?
The one on the right has, you can see the prominence with the one that hasn't been done of the vessels and the tendons, giving sort of a scrawny, you know, a lot of my patients say it's like a chicken's hand, that sort of scrawny look. Whereas when you elevate it, it's got this beautiful, soft, rounded, youthful hand. So if you look at a young person's hand, they've got that beautiful soft tissue. So it's about elevating and just recreating that look.
And that's all done by injections?
It's an injectable technique. You actually create a grid and you actually infuse the product throughout the hand. Good news is it really doesn't hurt at all. I've had it done to one of my hands so I can have one-on-one. It's not painful, and it's just fabulous.
Well, looking at this shot, this is a classic example. Talk about things looking like chickens, I might say.
Yes, yes.
But it's great to see a hand that hasn't been out in the sun, isn't it? So you can clearly see now the one on the right hasn't been done.
Correct.
The one on the left has.
Yes.
And it has literally wiped years off someone's
Absolutely.
hands,
You can walk into the practice, have your backs of hands done, and walk out with your hands basically 20 years younger. So it's been incredibly popular.
So what sort of time frame is that going to last?
The product actually lasts for approximately 2 years. So the calcium hydroxyl apatite are tiny calcium particles, 40 microns, without getting too technical, and basically your own body grows collagen around the calcium particles. So it actually creates neocollagenesis in the back of your hand. So the actual act of injecting the product in actually creates collagen growth as your body heals the little traumas from putting the product in. So it has a double benefit.
Well, we've seen the difference it's going to make with the scrawniness of the hands, but what about all the sunspots that people tend to get on the hands?
Well, at Face Today, what we're doing is we're combining it with intense pulse light, which a lot of people will have heard of. And with intense pulse light, you've got what we call age spots. So those little brown spots also denote age, because again, look at a young hand, look at an older hand, and you can pretty well clock the years. So in using intense pulse light, you're going to actually remove a lot of your brown sunspots.
And that's intense pulse light, or IPL, I think
IPL
is
the abbreviated word, yes.
You've also done, we're looking at a shot now where we can quite clearly see the sunspots. That's obviously the same person's hand.
Yes. This particular patient, we elevated one hand with the calcium, with the Radius, and then on the other hand, we actually didn't elevate, but we did IPL on the good hand as well.
So you can really see how much they've diminished.
It's phenomenal.
And you've always been a guinea pig yourself.
I'm always, if I'm going to do it to a patient, I'm going to do it to myself. So
do you want to hold up and show us the difference between your hands? Now, again, very clearly, you can see on your right hand, you still have your veins that are clearly showing.
Yep, veins and tendons, and looking a bit 51-year-old and scrawny. And I think my other side, I'll probably give that about 30. I'm feeling pretty happy about that.
As you would. And you've done IPL on both, haven't you?
Yes, I have. Yes, yep. And the other advantage with the IPL over the calcium over the Radius is that each little 40-micron particle grows collagen. So when you do intense pulse light, it actually grows collagen. So it actually increases the result of your Radius injectable by actually growing more collagen around your calcium, which will give you a much longer result. So it's beneficial to do the two together.
Thanks for bringing us up to date with all the latest techniques. It's wonderful.
Pleasure.